If you've ever been told that your only option for knee osteoarthritis is to wait until it's really bad and then eventually need a total knee replacement, today's conversation may change the way you think about treatment options. What exactly is knee OA?
We're going into the artery, embolizing it, which simply means putting in small beads that block the artery. That's how you get relief of your symptoms.
Is this where you feel like GAE is kind of that in between?
Absolutely. The GAE does not replace it. It's more of a bridge. Most patients are able to go back to work the next day.
I would love to hear a patient's story.
He was limited to maybe 2,000 steps, and he's back up to about 10,000 steps.
If you could tell someone right now who's trying to avoid major knee surgery,
I would tell them to seriously consider the GAE.
Hi everybody, this is Rachel here with the OBL and ASC Marketing Blueprint, brought to you by Patient Pro Marketing. Today we're going to talk about knee osteoarthritis. If you've ever been told that your only option for knee osteoarthritis is to wait till it's really bad and then eventually need a total knee replacement, today's conversation may change the way you think about treatment options. We're joined today by Dr. Sheth with the Georgia Endovascular Group to talk about genicular artery embolization, which is a minimally invasive procedure that is helping patients reduce pain, improve mobility, and potentially delay or even sometimes avoid major surgery. Let's dive into it right now and see how GAE works and how you may benefit from it. Thanks so much, Dr. Sheth, for being with me today.
Thanks for having me, Rachel.
Awesome. So tell everyone a little bit about your background and how you became involved with treating knee pain, specifically with GAE.
That's a good question. It's a long story, but I'll try to keep it as concise as possible. So I'm classically trained as a vascular and an interventional radiologist. And so everything that we treat is from a vascular perspective. So the field is always on the cutting edge, and we're always looking for different ways to treat different disorders that have not been treated from a vascular perspective. And that's kind of how the treatments for the knee have evolved.
And what has led you specifically in your group to focus on this treatment there at Georgia Endovascular?
I don't think that we necessarily focused on it. We're a group that are able to treat a wide variety of disease processes. Really what it came down to is the need and the want. So just being in the community, so many patients suffer from osteoarthritis, and it's something like 40% of people in America suffer from osteoarthritis. So we just got inundated with patients that were having problems with their knees, have gone through a lot of conservative therapy, maybe weren't candidates for a knee surgery, or just preferred not to have a knee surgery. So that's where we fit in as a group and how we think that we can help patients in our community.
Well, you guys do a lot of GAE, so that would make sense if you've got just the organic, natural interest for it. What exactly is knee OA? I know it's different than rheumatoid arthritis, regular arthritis. Can you explain it a little bit for us?
Right. So knee osteoarthritis is caused by long-term wear and tear on the knee joint. And what that causes is a long-standing dynamic process of continuous repair and regeneration, destruction of the area that's affected, which in this case is the knee joint. So similar to if you were to get stung by a bee or something like that, start getting a lot of hyperemia. So those are abnormal blood vessels that are causing a lot of blood flow to come to the area to try to help repair the damaged tissue. And so that process, this is the same in the knee. Over the course of time, you start having slow but continuous wear and tear that causes this repeated process of repair and destruction, and you start getting abnormal blood vessel formation. So if you have this right here, if you could see, this is what normal blood vessels to the knee joint would look like. And then, as you could see, the abnormal blood vessels looks more like a tree. And so essentially what we're doing is we're going into the artery, embolizing it, which simply means putting in small beads that block the artery and shuts down the area of the inflamed area of the knee joint. And that's how you get relief of your symptoms, because inflamed areas what are the areas that are causing pain.
So besides pain, what are some other symptoms that tell patients they possibly could have knee osteoarthritis?
So pain during activity is a big one. You can have morning stiffness that typically lasts around 30 minutes. And then over the course of time, you have limited or decreased function. So maybe you were able to climb up all the way up your stairs, but now you can only go up a few steps before being in severe pain.
Oh, and most patients, when they experience those symptoms, right? First step is they either go to primary care or orthopedic, pain physician. I hear a lot that it's like they go to a provider and they're given injections, right? And we hear all the time that they don't work that well, they don't work that long, and eventually they need a knee replacement anyways. Is this where you feel like GAE is that in between?
Absolutely. There's still a role for total knee replacement. The GAE does not replace it. It's more of a bridge to therapy. And so, you equally said, there is a role for conservative therapy. And so by the time most patients come to me, they've told me that they've had multiple knee injections, whether that be steroids, gel, plasma, different things. It's got mixed effectiveness. So some patients say it doesn't work at all. Some patients says it does work for them. And some patients say it did work for them, but over the course of time, it got shorter and shorter.
So
And so
is that your prime candidate for GAE? What's a good candidate for genicular artery?
prime candidates are patients who have undergone conservative therapy, but have undergone trying to use over-the-counter medications like nonsteroidal anti-inflammatories, ibuprofen being the most common. And they've tried all of those different measures and are now faced with the next step. And that's where we come in. So a lot of patients are finding us just simply by trying to find alternative ways to deal with their pain. And oftentimes they've already been told and they know about the knee replacement, but they start digging and learning more on their own. And that they find us, luckily, and we're able to help them tremendously.
Awesome. You gave a teaser earlier about the procedure itself and how it works. Can you go into a little bit more detail with us on
Sure. The
GAE
way the
itself?
procedure works is we make a small, tiny pinhole puncture in your groin. And from there, we take a catheter down to the knee. You are under what's called conscious sedation. So very light sedation, very similar to if you had a colonoscopy before. So once I take the catheter down to the knee, using contrast and x-rays, I find those areas of abnormal blood flow. And so inject contrast under x-ray, and that's when I can see the abnormal blood vessels that are supplying blood flow to that hyperemic or inflamed area of the knee. And once I see that, that's when I emit the small beads slowly, and it's able to take out or prune that tree that I showed you before. So we're keeping the parent arteries healthy that still supply all the blood flow to the knee, but we are getting rid of the excess blood flow to the knee that's causing all the issues.
And then recovery, this is done outpatient. I know you guys have a beautiful facility there.
This is done on an outpatient basis. So after the procedure, we observe you for a few hours and then you go home the same day. You don't stay in the hospital. Most patients are able to go back to work the next day.
Wow, that's awesome. I know anyone that's had a knee replacement knows you're not going anywhere the next couple days. And there's lots of physical therapy, risk for infections, and all these other things. Is GAE for everyone who has knee pain? We get asked that a lot, right? If I have knee pain, is GAE going to work for me?
Right. So overall, there's subjective and objective things that we look at to see if you are a good candidate for the GAE. So first step obviously would be an initial consultation to get a good patient history, get to understand patient story, see what kind of treatments they've had before, see if there's anything that we can do to help them become candidates for the GAE. So there are grades of osteoarthritis 1 through 4, and so we are able to determine that by getting an X-ray and MRI. So the ideal candidates are patients that fall in the 2 to 3 range. When you get to grade 4, that is more severe on bone. Patients have or can respond to the GAE, but at that point you have to set expectations, and just because it may be more limited relief. Beautiful thing about the procedure, it is repeatable. However, obviously, we want to do it once and have it last as long as possible.
And we get asked that a lot. How long does it last?
Right. So typically about 2 years, I would say, on average, is about, in terms of the literature, how long the duration or durability of the procedure.
Which is way long. Steroid injections, you're looking at what, every 3 months, right? Usually they put them on a cadence for that.
Typically, that's the schedule. But so a little bit more involved than obviously a knee injection. It will take a day out of your schedule, but risk to reward, the rewards are just tremendous. We see that in patient feedback after the procedure.
I would love to hear if you could share maybe a patient story, someone that you treated that kind of sticks with you that maybe you like to share with other patients about you.
I have these success stories are becoming more common, which is after so many years of education, this is what we work for. So it's been really rewarding, and I'm happy to help as many people as I possibly can. So I guess a patient story that sticks out just because it happened earlier today was a patient. He's about 72 years old, very active, but as I had mentioned before, over the course of time, had more limited mobility and functionality in his knees. And so we did the genicular artery embolization in his left knee to begin with, got very good relief, came back about a month later, we did the right knee, and then he's just ecstatic. He actually texted me and lets me know that he's able to go hiking again. He was limited to maybe 2,000 steps, and he's back up to about 10,000 steps. So very happy to hear. He tells me he feels like his knees are when he was 50.
That's great. And that's his knees, not a
His-
total knee, right? Those are
Absolutely his
yeah.
knees.
That's so cool. One of the things doing the direct to patient marketing, we talk to a lot of patients at the very beginning of their research and looking at the GAE and what it is. And one of the things we ask is, what are you missing out on? What is your knee pain holding you back from? And the things, sometimes we're in tears, right? Some of these patients are in tears just because the fact they miss gardening, hanging out with their grandkids, going hiking with their wife, things like that. So I think it's really cool for you as the provider to even ask those questions and hear it and then them celebrate it with you. It's texting you and telling you how awesome it is and sharing his steps and stuff. So I think that's just a testament right there to the procedure itself. But it sounds like you and your staff have just great rapport with patients as well.
I think that's a good way to put it. We are obviously go to school for many years and we know so much technical information, but in the end, you just when we're sitting next to the patient and listening to their story about how they've bounced around from doctor to doctor and couldn't really find the relief that they needed, and in 30 minutes within talking to them, give them hope. We give them an option that they never really thought about before, when the other option was something that they didn't necessarily or not necessarily ready for, which is surgery.
So if you could tell someone right now who's trying to avoid major knee surgery, but living with daily pain, what would you tell them?
I would tell them to seriously consider the GAE. Come give us a call. We'll sit down, have a conversation, really get to understand what's going on. And I treat all my patients as if they're family. And so I would give my honest recommendation as if they were family. And therefore, it may be an option you never considered before and could be right for you.
That's awesome. So for those who are in the area, you have several locations, right, in Atlanta?
We have a location in the Cumberland Vinings area, which is near the Braves Stadium. And we also have a location in Tucker and Stockbridge.
Great. And your Georgia EVA, I think it's your website, right? I'm just going to plug that
It
for
is
everybody.
GeorgiaEVA.com.
Good. So if anyone local sees this, wants to do some homework, I know their website is full of patient testimonial videos, like the story you just shared about the gentleman going hiking. And I think you've got a lot of other ailments and parts of the bodies that you guys can treat very similar, like elbows and shoulders, right?
Minimally invasive catheter directed treatments. So we call them procedures because they're not surgeries, and they're all outpatient.
So I think really anyone that has osteoarthritis of your knee, if you've got foot pain, if you have shoulder pain, there's lots of other information on the website for you.
Yes, that's true. Come check us out. I think there may be ways that we can help you that you may have not considered before.
Yes, awesome. Well, thank you so much, Dr. Sheth, for being with us today and sharing this. Hopefully, we've reached out to some people in the area that are struggling with that, tried the injections, maybe kind of leery about having a total knee replacement. Oh, I do have one question before we go because we do get asked this a lot. If somebody's already had a total knee replacement and they have pain afterwards, would GAE be an option for them?
So yes, absolutely. So patients can get relief after having a knee replacement. And to the same point, the GAE does not prevent you from having a knee replacement if that's something that's needed in the future.
Awesome. Again, lots of information on the website, guys. Go visit them, GeorgiaEVA.com. Thanks, Dr. Sheth, so much for being here with me. I hope you have a great weekend.
Thank you so much. You have a good weekend as well.
Thank you.